disconnected, and here is your question.
Okay.
You'll be given, I give normally 1 minute to read, but in the exam you'll be given 9 minutes to prepare the case in the day.
Okay.
Just 3 seconds. Yeah. All right. So if you have read and understood, considering this communication skills station, can we begin? Dr. Abdul Razak?
I have read the scenario as well.
Yes. So has he got disconnected? Can you begin?
Yes. Good morning. I'm one of the doctors managing your husband in the surgical team. Can I confirm your name, please?
Name and age.
Yeah, my name is Burhan.
Okay. Can I confirm the relationship with Mr. X, who is on our ward?
He's my wife. She's my wife.
No, you
Okay.
husband.
Okay. Your husband.
Husband.
Okay.
Yes. He's my husband.
Okay, it's your husband. I'm so sorry. I understand you guys are going through a difficult time. I'm sorry. Anyways, I'm just here to update you on the progress so far made on your husband. May I ask if you have any, if you know what we are managing your husband for? May I ask if you have any knowledge about his condition at all? Hello?
How much
Hello?
you know?
Hello, may I ask how much you know about his condition presently, please?
Just tell as much as you know.
Ma'am, I got disconnected. I'll be connected in shortly.
Okay.
Yes, sorry, I was just asking, I want to know how much you know about your husband's condition, please.
Can anyone else
Hello?
help?
Hello, ma'am.
Yes.
Hello. Yeah.
Yes.
Can I help him?
Yes.
Yes, sure. Yes, please.
Yes,
Yeah, my
yes.
husband has a short in her breast for last 2 weeks, and he developed swelling in the tummy. That's why we are here.
No, I'm so sorry about that. Do you have any idea of what is causing the swelling in the tummy? Have you been told?
No, I don't have any idea.
I don't have any idea. I'm so sorry for what you're going through. I would like to update you with your husband progress so far. Would you like, please, can you have a seat? Would you like somebody to be with you? Are you with
No, I
somebody?
am alone.
You're
You can
alone,
speak
okay.
to me.
Okay, are you happy for me to go ahead?
Yes.
Are
Sorry?
you happy for me to go ahead?
Yes, you can.
Okay,
I
thank
just
you very
want to
much.
know why CT is postponed today.
Yes, thank you very much. I just want to update you on your husband's condition first. He was sent to us by his GP because of the abdominal swelling, like you know, which is causing the shortness of breath because of the swelling of the abdomen is probably occupying much space and not giving him not giving him room to breathe because of the the tummy that has gone bigger. So like you already know,
Okay.
they did some aspiration of what was in the tummy and got some fluid which was sent for tests. And sadly, it showed that your husband has some malignant cells, which are tumor cells, cancer cells. So, and we've sent this for tumor markers, and we are waiting results. But like you've heard, the problem we have right now is our CT scan, which he's supposed to have done today, because I'm sure that you expected him to move for CT scan already. But unfortunately, this will not be able to be done because our CT machine is currently faulty, and we don't have any guarantee that it's going to be fixed this week. So the earliest time for us to have this fixed is next week. However, we will not just be watching your husband. We'll do what we can do. We'll pursue the tumor markers results. We can also offer him an ultrasound scan so as to have, an initial diagnosis of something and help us work with. And this is why I've actually requested to speak.
Is there any alternative for the CT scan?
Yes, the alternative now, of course, although it is inferior to the CT scan, is the ultrasound scan that I've talked about. It can tell us what exactly is the issue in the tummy, whether there is swelling from the intestine, or from the liver, or from the spleen, or from whatever. It can tell us. But of course, the CT scan is the gold standard that will tell us exactly. Unfortunately, like I've mentioned, for reasons that are beyond our control, like machines can go faulty anytime. And because this place is also remote, it's not a city center, so we're not able to get somebody to get this fixed before next week.
But I heard that this is a huge hospital, every facility is present there, then why you people are not doing CT scan? Should I transfer my husband to another hospital?
No, we're really sorry. We do CT scan. It's just that our CT scan is faulty. That's the problem. But meanwhile, even though it's faulty, we'll do some things. We've taken samples for tumor markers, which is actually very sensitive, which will tell us what tumor we are dealing with. And I feel form for us to have an ultrasound scan done as soon as possible, so that we can keep going. The fact that we can't do CT scan does not mean that we're going to stop all care for him. So if it's going to affect his safety, of course, we'll probably just refer you to somewhere else. But that's not going to happen, because giving him treatment, we're doing other investigation we could do pending the time that we can do the CT scan.
But I cannot wait for the 2 weeks. And why you people are saying CT scan is must? Do you think it is a cancer?
No, we're really sorry about this. It doesn't happen. It doesn't happen. It's not planned. And unfortunately, we just have only one CT scan in the hospital. We're really sorry. We're deeply sorry about this.
Do you think that he will need surgery right now?
Right now, I can't say whether it's going to need surgery or not going to need surgery until we have the result of the CT scan. That will probably guide us more on what we can do, whether we need to do surgery or just probably give him drugs, chemotherapy.
But he is not fine. Even he could not breathe well right now.
Yes, he has been admitted in emergency, and I promise you right now, he's been attended to by the best hands in the hospital. He's currently on oxygen, and it's been taken care of. Really, we've run some other investigations.
Even my family members don't know about this condition. So should I tell them everything that in your hospital CT scan machine is not working? We have to stay for more than 2 weeks. What should I do now?
Yeah, well, what we can tell you right now is that he has a cancer. We're really sorry that this is coming to you right now, but we can't tell you what kind of cancer it is until we've done the test. That is the problem. But of course, we've taken sample for tumor markers, which is very sensitive, and we should be expecting the result in a couple of days. Hopefully, by the time the result is out, the CT scan machine is fixed, and we can get him on the CT machine and be able to advise you better on the options of treatment for your husband. We're really sorry about this.
Okay, doctor. Thank you.
Thank you very much.
Okay. Can you give the feedback?
Ma'am, overall it's good, but I think there's network issue as well. So that's why I did not understand few words.
Yes, but then do you think, in your opinion, Dr. Abdul Razak explained well his case?
You are very cool and calm, and
Yes,
he has done good job.
even you were not angry. Here, but
Yes, he was
wife
not
will
angry.
be very angry and will be like snapping like.
Yeah,
So you were also calm. So no one was like,
I expected him slapping me via the
yeah,
headset, you know.
yeah. Because here, like
It's
the
so
moment
difficult
doctor
for
will, yes, doctor will come and say, okay, I'm sorry, you've been waiting for too long for Mr. Man, and angry wife will jump and say, are you Mr. Man? I'm waiting for 1 hour for you, or like she'll be like aggressive. So none of you were showing the signs of aggression, but in the exam, you should be mentally prepared to face the aggression, because actor will be actor, and you are not the first candidate they are facing, so they'll be very aggressive. Women will be aggressive.
Ma'am, can I ask one question?
Yes, please.
Yeah, ma'am, in this scenario, the patient has been diagnosed with malignant cells on cytology. So
Yes.
can we say for
Yes.
sure that he has cancer to the lady, or we just need to be awake that something is suspicious, we need further
Yes, further
confirmatory tests?
confirmation. And then even if it's cancer, you don't know how far that has gone. And because what I said, Dr. Abdul Razak did not explain why CT was needed, because if you need CT for staging. So if you know what stage that is, your management or treatment depends totally on that. So even if it's cancer, you cannot, like, tumor markers has been sent as well, and it is already diagnosed case, but then you have to know how far that is, and then how are you going to, what management strategies are you going to adapt, and how are you going to manage it. So that's one thing I think he needs to improve. Right. And when patient said, when the patient's relative said that my husband is really not well and having a breathing difficulty, then you'll say that what you think you should manage. You'll draw some fluid out, and this will relieve the tension in tummy, and it will help in breathing a little bit. So that alternative you could have.
All right, no wala.
And some medications
No,
as well.
it's fine. No wala, no wala.
And then when you
Alright,
were
take care,
telling
yeah.
about alternatives, like
That's it.
ultrasound, you said you can also tell MRI as well, but then why MRI is less than CT scan? And when patient said that, okay, if it's not helping, you only have one CT scan and it's not functional, I'll take my husband to another hospital, then you could have explained that it will waste your husband's more time and all that. New appointment.
Ma'am, there is one question.
Yes,
Yeah, thank you very much. Thank you very much.
Yeah, madam.
yes.
Sorry to interrupt.
No, that's okay. Yes.
If it's not it's not mentioned that we can refer him to another hospital, can we make up the story? Like we are asking another hospital to arrange. You can't do that, right?
No, nothing. You'll add from your own self.
Okay. Okay.
I told you, whatever is given information in the first bay, in the preparatory bay, you'll take that. If something which is asked or discussed in the next bay with consultant or with the patient's relative or with the patient, and if you're not sure, you say, I am not sure, I'll get back to you after confirming.
Okay.
So nothing you add from yourself, because that's what they want to see, how good you are in communicating with the patient. If you are adding things from your own self, or you're managing with the information which has been given to you, how careful you are. So nothing, don't add anything from your side. Good, thank you. Started your timer, and here is your question.